see if you sit back. Yeah.
Hi, Dr. Brian Amison.
I'm Dr. Richard Huetter.
So welcome to Tuesday Tooth Talk. We're kind of constrained today.
We're in a different venue, but we're getting used to it. We're going to probably move around the office in various places anyway, so you get to see how pretty our office is. So we'll try to make it a different place next time.
And I don't know if you noticed, I have a different. I don't have a lab coat there, so thanks to Lori Sarika for the jackets there. So I won't do a little fashion show yet.
No,
at some point.
New garb for Dr. Amison. I'm traditionalist. I'm sticking with my white coat for now because it actually has my name on it, not his name. So I don't want you to get us mixed up.
I know.
So I'll make sure you get my name right here.
There we go.
So what are we talking about today?
Today I think we're talking about oral cancer or mouth cancer.
Yes. Unfortunately, one of the things we get to see, not commonly, but we do get to see it and diagnose it, are oral cancers, predominantly from mouth lesions. That's why we look inside your mouth. So that's what we're going to talk about. I thought today, what do we do when we look for cancer?
Right. So you always wonder, we're just talking about teeth, but it's more than just the teeth. I mean, it's the whole oral and facial structure that we're looking at. So, I've had people come and say, well, why are you looking underneath my tongue? Why are you looking there? Because everything is all connected.
Right. Well, yes. I don't always look externally so much, but internally, we're looking at the inside surfaces of your cheeks, the vestibule, which is where your cheek and your jaw come together. That's called the vestibule. We're looking for what are we looking for, Dr. Amison?
I always say we're looking for something red, white, or blue. So the American flag.
We're not looking specifically for the flag, but we are looking for those colors. And some of them, are considered normal. Red. Well, did you hurt yourself? Did you burn yourself? Something like that, where you can actually attribute that appearance to something that has happened. And then the other things are, what's blue?
Let's see, one of the stripes on the flag.
No. Well, blood vessels.
Right. Mm-hmm.
So sometimes blood vessels or blood-filled vesicles or sacs, which don't belong somewhere in your mouth, because we're going to see veins.
Right.
We are going to, especially underneath your tongue. And as we get older or have high blood pressure, you are going to see distended or expanded veins, especially under your tongue. So sometimes you're going to see a lot of blue under there.
Right.
And like I said, if we can say it's a vein, well, then we know it's a vein. Now, if we see like round things or oddly shaped things or something on one side and not on the other, now we're getting concerned. And that would be true with the red things too.
Right.
And then there's the white things.
So tell me, other than your teeth, what could be something that's white?
White. Well, sometimes something called a callus, like a callus, or a keratosis, a thickening of the gum tissue. Sometimes a burn can cause a white appearance if it's like more than a day old and trying to heal. But there are some other things that are caused from notably smoking or use of chewing tobacco or pouches or whatever those types of things are. We definitely can see white things, white appearance on the gum tissue. Sometimes it looks wrinkled, sometimes it just is white, or sometimes it's small patches, sometimes it's larger patches. Sometimes it could be a yeast infection, candida. So there are a lot of things it can be, and that's part of our job, is to look at that and try and figure out what it is that we're seeing. So there are that's why we do what we do. And you'll know that Dr. Amison and I both, might pull your cheek out or pull your tongue out or lift up your tongue, because we're looking at all these places that you probably don't look at and don't see or would never notice unless it hurt.
Correct.
That's and sometimes that concerns us when we see something and you don't even know it's there.
Right.
You haven't seen it, you can't feel it, but for us, it might raise a little bit of an alarm.
And that's why, again, you come to see us because, that's what we
That's
look
our
at,
part of our
especially,
role,
right?
right?
Our role as dentists is more than just the teeth.
Right, and it's every year in the U.S. at least there's about 55,000 cases of oral cancer, and the 5-year survival rate for oral cancer is about 66%, which means a third of the people are not going to make it for 5 years, and that's from diagnosis. So that it is a concern. I mean, it's something that we are here to try to determine what we see. And if we don't see anything, of course, that's great.
Right.
But we do see a lot of different things. Sometimes we can say, okay, I'm not concerned about that. I know what that is. Sometimes we might need to, and we do quite often use different ways to view the surface of your tissue in your mouth, and that would be the oral ID, which is where we use that special colored flashlight and special colored glasses, and that light fluoresces on your tissue, and certain things look different colors under that light than they do, in regular daylight.
Right. So we have a lot of tools in our armamentarium.
Armamentarium. I love that word.
Sounds very dental. I remember that. But we have lots of tools that we can use, but also we rely on you as well. So as Dr. Huetter said, it's hard to see, but I always recommend self-checks. So we talk about self-checks for breast cancer and different types of cancer. So again, just go back to the red, white, and blue rule. And then if it's there for longer than typically 2 weeks,
right,
then we get concerned, because the good news about the mouth heals pretty quickly.
Very quickly. The tissue inside our mouths regenerates very quickly, and even a relatively severe injury, like a bite or a burn, it's going to be pretty much gone in 2 weeks. So that's why, and at least when I see something and you don't even know it exists, I'm going to try to show you what that looks like. I'm going to hand you a mirror and shine my light on that item of interest and make sure you see what I see, because you're the one who's going to determine, well, sometimes we'll make a 2-week appointment to come look at it again. And if you can satisfy us that you see that it's completely gone in that 2-week period, okay, then you're allowed to cancel that appointment. But otherwise, we're going to make that appointment because I want to see if it's still there in 2 weeks. If it looks the same, I'm a little concerned. If it looks better, okay, maybe it's still in the healing process. But if it looks worse, I'm definitely concerned.
Right.
So then we may have to take some additional steps. Biopsies, referrals for biopsies. Sometimes we can scrape the tissue and have those scrapings tested. So we do more than just teeth.
Right. And that was kind of what we wanted to bring up. So it's really important. Again, we do that oral ID typically once a year,
right,
on patients, because it allows us to see more than what we can see with the naked eye.
Right.
So as Dr. Huetter mentioned so well, we can see beneath the tissues or within the tissues. So again, it's another just form of ways that we can see, make sure you're all healthy.
Yep. Yes. And pretty soon, coming up the pike, and everyone's hearing about artificial intelligence. And hopefully for us, that it's going to be a benefit too. Maybe we can get images, and the artificial intelligence, however it's programmed, will be able to decipher what that picture is, or whatever the sample is, and maybe help us do the diagnosis faster, maybe more accurately. That's what we're hoping to depend on. Just some standardization too.
Right.
But that's coming. It's not here. Believe me, it is not here. Otherwise, we'd be using it, because we're pretty forward when it comes to adopting technology, as you may well know if you've been here. We do same-day crowns. We have 3-dimensional X-rays. I mean, we have a lot of things. So when that comes along, that's something we'll probably adapt.
Yes. Pivot and adapt.
Pivot. Yeah. That's why we're here.
Right. So, we thank you all so much for listening, and again, thank you for going through the process with us. Through again, we're in our like little spot here, but definitely happy with the outcome of everything. So
Yes, yes, a remodel. So yeah, it's great, and like I said, we're gonna find a prettier place to to sit instead of in front of a door.
right. So again, we thank you for watching. Any questions, call us at 330-452-2255. So for Dr. Brian Amison,
Richard Huetter.
have a great day.